Hey, this is Dr. Phillip Langsdon from the Langsdon Clinic in Germantown, Tennessee, and today we're going to talk to my associate, Dr. Roberto Lachica, about tummy tucks and find out what we need to know to see if we're a candidate for a tummy tuck and what a tummy tuck is all about. Who is a typical candidate for a tummy tuck?
The typical candidate is a postpartum woman having had one or more children who's had changes of the abdomen, specifically the lower abdomen or the lower tummy, sagging with stretch marks and loose skin and loose fat. These changes are correctable with surgical removal of this area to produce a flat tummy.
It's the patient that has stretched out and doesn't look like they did when they were 20 years old and they're wanting to try to recover some of that mid-body contour, right?
Correct.
Yeah.
So typically with pregnancy, the abdomen or the tummy gets larger and distends with the baby inside. The muscle stretch, the skin stretches, and in many patients, in many women, the tissues don't spring back.
Yeah.
And so there's a loose muscular wall and a loose lower tummy. And with age and with weight changes, also fat collects in the flank area, known as the love handles, and perhaps around the back. And most patients who actually have a tummy tuck, probably 9 or 9.5 out of 10 patients, actually have liposuction along with the tummy tuck surgery.
They do that to kind of blend the whole mid torso area.
Correct.
Well, who else, other than women who've had children, might be a candidate for a tummy tuck?
The other typical type of patient is a patient who's had a lot of weight loss, somebody who's been very heavy before and who's had a lot of weight loss from exercise, weight loss surgery called bariatric surgery, and now with the advent of Ozempic or those types of medication, we are now seeing patients who've had rapid weight loss from medication.
Do you see this in men also?
Yes, I do, absolutely. So even men have the same changes, obviously not from pregnancy, but from exercise or surgical weight loss. And we have patients who are very fit males who have good musculature, but they've had sagging of the tissues as well. And
Okay.
so these patients, these male patients, can also have liposuction and a tummy tuck.
Well, that's fantastic. That's good news for a lot of men to know. Where's the incision typically placed for one of these procedures?
The incision, there are two incisions actually. The big incision goes from hip to hip, so it starts from one hip bone, goes to the other hip bone, and curves down across the area above the pubis, and that's somewhat of a curved incision that goes down across the front. And there's an incision that goes around the belly button, and that is used to reposition the belly button at a higher place on the abdomen so that the belly button doesn't get pulled down towards the pubis, which would be very awkward looking. So there's two scars.
And what's the recovery like for these procedures?
In general, we tell patients to recover for 48 to 72 hours with their hips flexed at home to get through the initial immediate post-operative phase. And then we ask them to slowly get up and start walking around and start straightening up. Typically, there is a period where the abdomen is very tight and very feels tight and maybe uncomfortable. But at about 7 to 10 days, most patients are up walking around nearly upright. Certainly there's a period of time where we want patients to modify their activity, especially in terms of exercise and work.
Yeah.
But typically,
when can they exercise again? Generally, if they heal well, no problems.
we want patients walking, and if they can actually get on a treadmill at about 10 days.
Fantastic.
Yes. Things like running that produce a lot of shaking and whatnot, or exercises that activate the core, the abdomen, we want to wait till about 2.5, 3 weeks minimum because we don't want to stretch the area that we just operated upon. But definitely walking is something we encourage very early on.
Well, fantastic. Thank you for sharing this with everyone, and I'm honored to be here with the expert Dr. Roberto Lachica today, talking about tummy tuck. If you would like any other information, please feel free to email or contact the Langsdon Clinic. Thanks. Have a great day.
Thank you.